practice, no partners. I was on call 24/7, loved it. Absolutely loved my patients. To now not doing deliveries and doing women's health from an integrated perspective.
And say a little bit more about our speaker.
Good evening, ladies. I am so excited because we have a very special guest. It's my great pleasure to introduce. It's you.
What if it wasn't me? That'd be awkward.
What are you doing up here?
It's not your turn.
So obviously Jennifer is Dr. Sue is my colleague and a very fun friend. She's a practicing obstetrician gynecologist, and she recently reimagined and redesigned her practice to focus on the health of the whole woman using a new integrative approach. She furthered her medical education. She completed an additional fellowship in integrative medicine at the University of Arizona, and now she brings back this valuable knowledge to Mid-Missouri. Her goal is to maximize the true health and well-being of her patients, and I am looking forward to hearing everything you have to say about how to make women more healthy.
I was trying to figure out why you all were interested. You're just nosy, because you've known me for 20 years delivering babies and doing PAPs and booby exams. And you're wondering, what in the world is that office up to? She gets to do anything she wants because I'm not connected to either hospital. I admit to both the hospitals equally. How did all this happen? What is integrative medicine? Some people think I'm a hippie now and I don't prescribe medicine. Some people think I do herbs and I use marijuana. But the thing is, integrative medicine should be all of medicine. So us as integrative physicians want all medicine to be integrative. So back up to 5 years ago, at the age of, how old was I, Jackie? I started complaining of everything. I'm now 48. Probably at the age of 45 or 44, I was like, you know what? I feel so old. Everything in my body hurt. I quit doing ballet because I couldn't do anything with my knees. My knees hurt. I couldn't do surgery because whenever I was doing surgery, I couldn't bend my hands. Everything felt like I was a 9-year-old woman. And to do my pap smears, to get that pap smear kit that you see your doctors open up to smear your pap in, I had to get those things. I asked the River Song girls, what is that thing you're using to open up the bottles of, what is it, fingernail polish? Bought them off of Amazon, then I could open up my pap kit. Something was wrong with my hands. I couldn't bend my hands anymore. I couldn't sleep well. My heart was irregular. I went to my primary doctor, who was Dr. Kimlinger at the time. He goes, I remember your dad had a heart attack. Why don't you just do some heart tests? Heart tests were fine. Dr. Sanfilippo's wonderfully ran me through a cardiac stress test. Nothing was wrong with me. He said, you're able to teach an hour of Zumba without a problem. Just take this medication for when you're under stress or you're going to have to do surgery, so it keeps your heartbeat normal, so it's not skipping all over the place. Fine. And he told me to quit eating chocolate. So I was like, okay, do you think I quit eating chocolate? No. And so then I go to see Dr. Link because I'm like, something else is wrong. I'm really sick. So I made the appointment with Dr. Chris Link, who is our inspiration to go to the University of Arizona. And I canceled my appointment like a month later because I was so scared because I didn't know what he was going to do to me because I knew he was this weird natural doctor. Then I made it again because I didn't feel good. He got me better because he found out that I was allergic to both gluten and kidney beans, and all I was eating was Ritz crackers and chili all the time. So then he put me on little breathing exercises for stress. Then I got better so quick that I was in the bathroom and Jack goes, hey, sweetie, he got his training from the University of Arizona. We can apply and try to get into this program called Integrative Medicine. I'm like, okay, his ideas are always good. We got in, we had to apply, say an essay, they had to see if we were really into this, and then we both got accepted. It was the University of Arizona was founded by Dr. Andrew Weil. If you look in your cookbooks, he's the guy with the big white beard, and he says food is your medicine. So what we eat truly is our medicine. But I had one in my cookbook pile for like 20 years, didn't even pay attention who this guy that looked like Santa Claus was. He's the founder of our program, so we got to meet him. He gave us lectures. So What my doctors didn't know was what caused all this. I'm Chinese, like we eat gluten, like it's air. Like everything's labeled gluten. Gluten cookies, gluten, everything gluten, gluten, gluten. Why at the age of 45 was I now allergic to gluten? Well, none of the doctors knew. Dad had retired 3 years prior, so all his patients came into my schedule. So that's additional stress. Then I took on Zumba Kids. And so that knocked out, he warned me, he goes, you're using the last morning that you have to sleep in to teach Zumba Kids. So that knocked out the one morning that I could sleep in. And then the Cap Region group lost like 5 OB doctors for one reason or another. One moved away, 2 retired from obstetric. So the group goes, hey, can you cover for us just like one weekend or 2 here and then? Sure. So I took that on, and the one weekend I covered them, I got like slammed. I was like, is it always like this? They're like, no, really, Dr. Sue, it's not always busy like this. I'm like, I'm so tired. So then I wound up in the ER with what? I had pneumonia. I was so sick. He's like, you gotta do something. So I gave up Zumba Kids, and then I told the Cap Region, I cannot help you anymore. I'm really, really sick. Something's wrong. But Dr. Link knew to ask all that, and so he got me on a breathing exercise so I could handle my stress. So when you go see your doctors, they are really good doctors. We're just not trained in this, but the newer doctors are, because we did, the St. Mary's had the top, Dr. Yonkers, there's more younger doctors. They're trained in this. This is just what my husband, Dr. Lucio, and I decided to go back to school for, because we weren't trained in this. We weren't trained to look at the whole person, to ask what fuels them, what makes you happy, what drives you, what makes you click and tick. So when doctors say they have non-compliant patients, they don't have non-compliant patients. You might get a crazy one every now and then that won't do anything you say, but most of the time they're not going to spend time going to a doctor just to leave and not take their medicine. They're not going to go to a doctor just to like get probed and then not do the surgery. So I'm going to give you an example of how this works. Okay, so I'm going through school and then I get called from the ER. Hey Jen, they never call me Dr. Sue. Hey Jen, sometimes I gotta hey you. Hey girl, we got this girl, you know, you gotta come see her. She's got this ovarian cyst. I think she needs surgery. Anyway, come on in. Okay, go in. No one told me that she had shackles on her foot because she's on, what is that, house arrest? Right, that would help a lot. So I go and I'm like, you know, my friendly, like, stranger face. Hi, I'm Dr. Sue, what's going on? And then I see the shackle for the house arrest. I'm like, oh, why didn't they tell me? So then they taught me to talk to people. So I go, oh, what's going on? Oh, you know, I just had this pain here. I go, oh, really? Wait, no, what's going on in your life? Oh, I just, you know, cleaned myself up. I got out of the bad situation I was in. I dropped all the bad friends. I've been on house arrest, but I just got released. And I'm really having fun taking care of this pet grooming business. I'm like, really? That's a pet grooming business? Now, I'm going to be the doctor I was 5 years ago. I still have the friendly face. Hi, I'm Dr. Sue. I won't even sit down. Hi, I'm Dr. Sue. Yeah, I'm in a hurry. Okay. Yeah, how are you? Okay, yeah, you have pain? All right, they told me that your ovarian cyst is about 4 centimeters. You need surgery, so we're going to get you ready and we're going to go take you to surgery. Now, this is the new Jennifer. Oh, you own a pet grooming business. No, I don't own it. But like, this girl gave me this opportunity to change my life around. And now I'm able to groom dogs, but I'm the only one there because the owners never have time, so I run the whole place. I mean, me being in the ER, I don't know who's running the show. I'm like, oh, wow. Well, you have this ovarian cyst. I don't think you can have surgery, can you? Because no one can take care of these dogs while you're gone. I'm really scared that you're going to do surgery. I go, don't worry. I go, how would you like to just know it's not cancer? And if you don't have that much pain, why don't we just repeat your ultrasound in like 3 months? Oh, I would love that. Now see, that's all you have to do is just know where that person's coming from. You're dealing with the whole entire person. So back to our integrative program, they taught us to talk to the patient, to touch the patient. Like, doctors don't like to touch you. I don't know why nurses touch patients all the time. They're rubbing them. Sorry, the doctor's so mean. But a bigger part of integrative medicine is really incorporating things from complementary techniques and alternative. So if I see a patient that might need acupuncture or Chinese herbs or Ayurvedic medicine from the India, that's a great system of medicine. They made us learn everything about everything kind of medicine. Traditional Chinese medicine, Ayurvedic medicine, acupuncture, chiropractic. I was taught chiropractors are quacks. Isn't that terrible? That's where we come from. So as integrative doctors, Dr. Chris Link and Dr. John Lucio, we're still who we are. Like, I still see female patients for gynecology. But man, you tell me something like, I say, what medicines are you taking? Oh, I'm still on the Pepsid. I wish I could get off of it. Oh, really? Well, let me tell you how. I love that stuff. Or they want to feel better. I go, you want some IV nutrients because your gut cannot absorb more than maybe 60 to 80% of nutrients that you eat. Because even in a healthy person, we gobble those vitamins. They could be really expensive vitamins. If we're inflamed and stressed like I was, I'm only going to absorb maybe at the most 60% of those vitamins. And you're wasting all those vitamins. So we give IV nutrients now. So we treat the internal person. And we like to make people pretty and happy because every woman wants to look younger but natural. So now we learned O-Shot. We learned vampire facelift. We learned P-Shot for men. Every man wants to have a longer time during intercourse. So we're trying to address the whole person sexually, vitamin, nutrition-wise, hormone optimization, and also incorporate other things from other medical systems. Just so it's treating the whole person. So what other questions do you guys have?
What was vampire face?
Vampire is named after a technique that Dr. Charles Runnels, that's a good question because my mom's like, vampire, why would they name it that? We use your own blood. So we draw about 1/4 of a cup of your own blood and we've learned to spin it down in a biological centrifuge. And what it does is, remember when you were little and you scraped your knee up and you had that black scab, but it starts itching, you want to peek underneath to see how it's healing and your mom goes, don't pick at that. But we all picked it off.